This one sounds like a joke, but it's a very real medical case. Back in 2016, a woman named Christine Connell was recovering from ankle surgery and was confined to a hotel bed. She couldn't move much, and during this vulnerable time, her then-boyfriend decided to pull what he thought was a harmless prank. He farted directly in her face. At first, it was just gross and humiliating, but within days, Christine began to notice strange sinus problems, constant congestion, pressure, and pain that just wouldn't go away. She went from doctor to doctor, but no treatment seemed to work. For years, she was stuck in a cycle of antibiotics, nasal sprays, and endless sinus infections. Finally, after nearly 7 years of suffering, specialists discovered the shocking culprit. E. coli bacteria had colonized her sinuses. This type of bacteria normally lives in the gut, not the nose, and its presence there is both rare and dangerous. Doctors concluded that the most likely explanation was the prank. What started as a moment of childish humor ended up altering her health for nearly a decade. It's a bizarre reminder that sometimes the strangest medical cases come from the smallest, most unexpected moments. Italian man sneezes out a bullet. In 2011, the streets of Naples were alive with their usual raucous New Year's Eve celebrations, fireworks, firecrackers, and even the occasional fired gun. Amid the chaos, a craftsman named Darko Sangamano, 28, wandered the streets with his girlfriend when fate took a wild turn. A stray .22 caliber bullet struck him on the side of his head, behind his right eye. It grazed his temple and slowed down upon hitting his skull, preserving his vision and, remarkably, his life. The bullet then traveled through tissue, pierced the nasal cavity, and lodged in his nostril. Bleeding heavily, Darko was rushed to the hospital. But while he awaited treatment, something almost unbelievable happened. He sneezed violently, and the bullet shot out through his right nostril, right into the hands of stunned doctors. Surgeons cleaned up the damage, removing bone fragments from his eye area. Despite the ordeal, surgeons expected him to fully recover his sight, though he'd require follow-up surgery to fix a scratched retina, the woman who turned blue from silver. In the search for miracle cures, some people turn to bizarre remedies, and sometimes the results are shocking. One American woman began drinking colloidal silver every single day, believing it would strengthen her immune system and protect her from illness. At first, she felt fine, but over time something strange started happening. Her skin slowly began to change color. Instead of the healthy glow she expected, her skin developed a permanent bluish-gray tint. Doctors diagnosed her with a condition called argyria, caused by silver particles building up in the body and staining the skin from the inside out. The condition isn't life-threatening, but it's irreversible. No cream, laser, or medicine could return her skin to its natural color. What began as an attempt to improve her health left her with a permanent, almost alien appearance. It's a striking example of how chasing alternative miracle cures can sometimes create medical problems that are far worse than the ones they were meant to solve. The woman with a plant growing in her lungs. Sometimes the body hides secrets that sound more like science fiction than reality. In Russia, a man went to the hospital complaining of severe chest pain and constant coughing. Doctors suspected cancer, so they performed X-rays and prepared him for surgery. But what they found inside left them stunned. Instead of a tumor, surgeons discovered a small fir tree sapling sprouting inside his lung. The theory was that he had inhaled a seed, which somehow lodged in his lung tissue. With the moist, dark environment and steady supply of nutrients, the seed had begun to grow, just like it would in soil. The tiny tree was surgically removed, and the patient made a full recovery. But the case quickly spread across international headlines, shocking readers with the idea that something as simple as breathing in a seed could lead to a living plant growing inside the human body. It's a surreal reminder that nature sometimes finds a way, even in the unlikeliest places. When a surgeon signed his work. In one of the most disturbing cases of medical misconduct ever reported, a 61-year-old obstetrician named Dr. Alan Zarkin delivered a baby by cesarean section, and then did something horrifying. After completing the surgery, he took his scalpel and carved his own initials, A and Z, into the mother's abdomen. The patient, 31-year-old dentist Liana Geddes, later described the permanent scar as making her feel like a branded animal. She sued Zarkin for $5 million, saying the markings not only caused physical damage, but also deep psychological trauma. "I felt like I was raped," she told the Daily News. The scar, she added, made her embarrassed to even undress in front of her husband. Witnesses in the operating room recalled Zarkin actually boasting after the delivery, reportedly saying, "I did such a beautiful job, I'll initial it." His colleagues were stunned. Zarkin's lawyer later claimed the doctor suffered from a rare brain disorder called Pick's disease, a type of dementia that can cause drastic personality changes and inappropriate behavior. But that explanation did little to calm public outrage. Dubbed Dr. Zorro by hospital staff, Zarkin was immediately suspended by Beth Israel Medical Center and reported to health authorities. The case remains one of the clearest examples of how devastating it can be when the people we trust most cross the line in unthinkable ways. As if one doctor carving his initials into a patient wasn't disturbing enough, another case from the UK shocked the medical world for the very same reason. Liver surgeon Simon Bramhall became infamous after colleagues discovered he had been using an argon beam, normally a tool to stop bleeding, to burn his initials into patients' transplanted livers. The markings weren't visible externally, but they remained branded inside the patients' bodies without their knowledge. Bramhall was eventually caught when another surgeon saw the initials during a follow-up procedure. In 2017, he admitted to 2 counts of assault by battery. Though none of his patients were physically harmed by the signatures, the act was called an outrageous breach of trust. The medical community and the public were stunned that a respected surgeon could commit such an arrogant and bizarre violation. It's another chilling reminder that sometimes the people we trust most in medicine cross lines in ways that are both unprofessional and deeply disturbing. The woman with 27 contact lenses in her eye. Eye doctors are used to seeing strange things, but nothing prepared a surgical team in the UK for what they found during a routine cataract operation. When they began the procedure, they noticed a bluish mass covering the patient's eye. At first, they thought it was just a buildup of mucus, but as they carefully lifted it, they realized it was a cluster of contact lenses. Not 1 or 2, but 27 separate lenses had fused together into a single lump. The 67-year-old woman had been wearing contact lenses for decades and admitted she often forgot to take them out before inserting new ones. Over time, the old lenses piled up, sticking together until they formed a solid mass that had been quietly irritating her eye. The woman was shocked when told, insisting she never felt anything beyond mild discomfort. Doctors said the case was so unusual that none of them had ever seen anything like it before. It's a bizarre reminder that sometimes the strangest medical mysteries come not from rare diseases, but from everyday habits we overlook. The man who felt every cut. Sherman Sizemore, a 73-year-old Baptist minister and former coal miner, underwent surgery in 2006 to diagnose mysterious abdominal pain. During the operation, paralytic drugs were administered, so he was completely unable to move. But tragically, the anesthesia meant to render him unconscious was not given on time. According to the lawsuit filed by his family, Sizemore remained fully conscious for 16 agonizing minutes while the surgeon operated, unable to cry out or move. He later described the ordeal as feeling buried alive. His family reported afterward that he suffered extreme insomnia, nightmares, and paranoia, convinced people were trying to bury him. Just weeks after the surgery, Sizemore took his own life. His family cited the trauma from that surgical nightmare as the driving force behind his tragic decision. A screwdriver as a spinal implant. In 2001, Dr. Robert Ricketson, a spine surgeon operating at Hilo Medical Center in Hawaii, faced a nightmare during a routine spinal fusion on 73-year-old patient Arturo Iturralde. During the operation, the 2 titanium rods intended to stabilize the spine weren't in the surgical kit. Instead of pausing or canceling the procedure, Dr. Ricketson improvised, horrifyingly so. He cut off the shaft of a stainless steel screwdriver from the instrument tray and implanted it into Iturralde's spine as a makeshift substitute. Initially, the surgery appeared successful, but 3 days later, the improvised implant snapped when Iturralde fell, causing excruciating pain and forcing multiple corrective surgeries. Despite all efforts, Iturralde's health continued to deteriorate, and he ultimately passed away in June 2003 from complications related to the surgeries. A whistleblower nurse even retrieved the broken screwdriver piece and informed legal counsel about the shocking improvised implant. In 2006, a jury awarded Iturralde's family $5.6 million in damages, $2.2 million in compensatory damages, and $3.4 million in punitive damages. The verdict found Dr. Ricketson 65% liable and the hospital 35% liable for its role in credentialing him despite his troubled history, including license issues in Oklahoma and Texas. The woman with a twin in her brain. In 2015, Yamini Karanam, a 26-year-old PhD student from Indiana, went through something that sounds straight out of a science fiction movie. For months, she struggled with constant headaches and difficulty concentrating. Doctors initially dismissed her symptoms, but when the pain became unbearable, she underwent brain surgery in Los Angeles. What surgeons found left everyone stunned. Buried deep inside her brain was a teratoma, a rare kind of tumor made up of different tissues. But this wasn't just any tumor. Inside were bone, cartilage, hair, and even teeth. In other words, Yamini had been carrying fragments of what doctors called her embryonic twin inside her head for 26 years. After the successful removal, Yamini joked about it, calling it her evil twin, but the reality was terrifying. Teratomas are incredibly rare in the brain, and cases like hers are almost unheard of. It's a chilling reminder of how the human body can harbor secrets for decades, sometimes hiding things we can barely imagine. The baby born pregnant. In 2010, doctors in Hong Kong made a discovery that stunned the medical world. A newborn baby girl underwent surgery after scans showed something unusual inside her tiny abdomen. What they found was beyond belief. She was carrying two partially developed fetuses. The fetuses were about 8 to 10 weeks old, complete with tiny spines, ribs, and limbs. This incredibly rare condition is known as fetus in fetu, where a parasitic twin begins developing inside the body of its sibling during pregnancy. In this case, the baby girl had essentially been born pregnant with her own twins. Doctors successfully removed the fetuses, and the baby went on to recover normally. But the case left scientists scratching their heads. Just how does something so strange and rare happen? Fetus in fetu is estimated to occur in only 1 in 500,000 live births, making this one of the most bizarre medical anomalies ever recorded. It's the kind of story that sounds like urban legend, but it's very real, and it shows how biology can sometimes blur the line between science and the unimaginable. That's all for today. Which of these cases shocked you the most? Let me know in the comments below, and don't forget to like, share, and subscribe for more unbelievable stories.